This is MS Talks 2.0 Let's Discuss Facts, a series brought to you by Novartis. Multiple sclerosis is an incurable disease, and if you receive a diagnosis, there can be a tendency to seek different approaches, such as stem cell therapy, in search of an elusive cure. In this episode, we're here to talk more about chasing a cure for MS to get a greater understanding of stem cell therapy and how it can be used within a patient's journey. Today, we're joined by Dr. Muna Thakre, consultant neurologist and head of neurology at Zahra Hospital and board member of Emirates Neurology Society, and Monal Harbi, MS patient advocate, member of the National MS Society, and transformational and personal growth coach. Welcome to the show.
Thank you for having us.
Thank you so much for your time. Doctor, can you please explain to us what exactly is a stem cell and where can it be found on the body?
Okay, so let's start with the very basic. Okay, so stem cells are undifferentiated cells. Okay, these are immature cells and they are mostly in the bone marrow, but they can be found in other parts of the body as well, like the brain, like the adipose tissue, like the cartilage and other parts of the body. So these cells, what they have this ability to differentiate into other cells. Okay, so different specialized cells as per the need of the body.
Can you explain to us what actually is stem cell therapy?
Yes. So stem cell therapy started when, long time back, about 20 years back. And stem cell therapy, especially with multiple sclerosis, came when these people were trying stem cell therapy for, blood cancers. Okay, and what they found that these patients with blood cancers, when they had autoimmune diseases, when they gave this stem cell therapy, they actually got better regarding their autoimmune diseases. Mm-hmm. And from then it has started, and we've been having a lot of studies and trials on this stem cell therapy. So what do you actually do with stem cell therapy? So let me just go through the steps. Okay, so what we do is the first step is to find the correct patient who is for the study. And let me start with the disclaimer that this stem cell therapy is not FDA approved yet, because we are still in the process of getting the finer and finer best treatment protocols for this type of therapy. Though in the phase 2 trials, we did find a very good results, okay, but it's not 100% results. So we are still fine tuning it because there have been side effects and there have been mortalities with it as well. So what do you do with stem cell therapy? So what we do is first, the patient has an injection to mobilize the stem cells. And these stem cells are lying in the bone marrow and the other parts of the body. So they are mobilized into the bloodstream. And then the blood is withdrawn. So what you do, you have a pool of blood which is rich in stem cells. And then what they do is they do something called leukapheresis. So they'll remove the white blood cells, okay, and then they'll cryofreeze it. Okay, so they can be used later on. And then what happens to the patient is he receives high dose chemotherapy. Okay, so this is to ablate the bone marrow completely of all the cells. So these cells which are there, which are attacking the brain, these cells are killed completely. Okay, and then what you do is you put these cells which you have removed back into the system. Okay, so they go to the bone marrow and they start producing new fresh cells. Now, these new fresh cells don't have the memory of the MS, okay? They are not sensitized lymphocytes, okay? So they are producing brand new cells which are not attacking your brain and spinal cord. So that is, in short, what actually stem cell therapy is.
How could stem cell therapy be applied in the treatment of MS?
So till now, we don't have the phase 3 data to have the approval for the therapy. Okay, so now what the phase 2 data did show, and actually we are relying on those because that's how people are getting interested in it, is that it does reduce your number of relapses to a big extent. So they found in the phase 2 data it was about 69% reduction in the relapse rate for the duration of about 5 years. Okay, but what they did also find that there was a lot of mortality with it. But with time, now this has been there since 1990s, and the latest data shows that they have refined the stem cell therapy, because now they are not going full on high ablation, so they are going low ablation. So they're fine tuning the type of chemotherapy they are giving to the patients, so the mortality rate has gone down. So now we'll be having 2 phase 3 studies, which is the STAR MS and the BEAT MS. one in US and one in UK. And this, what they will do is to compare this with the best available therapy. So we know stem cell therapy works in some people, especially relapsing remitting multiple sclerosis, early on who have less disability. It does not work with people who have already gone into secondary progressive phase or primary progressive MS. It doesn't work. So if you're advanced in your MS, you have already progressing, stem cell therapy is not for you. So it's only for early patients who have less disability and who are relapsing remitting. So these two studies, the phase 3 studies, are going to compare it with the best available therapy, because we still don't know if the hematopoietic stem cell therapy, which is the stem cell therapy which we are talking about, is it as good as or even better than the best available therapy.
When should it be applied in the patient's treatment journey?
Yeah, so as per the research guidelines, so you can only take it in a research study still, because it's not FDA approved. So if you are still relapsing remitting, that means you have attacks and you remit, you do not have a progressive course, okay, you have low EDSS. EDSS is a disability scoring. So if your EDSS is low, that means meaning that you're still able to walk and function, then it's for that, and you failed at least 2 first-line therapies, then only you have the need for a stem cell, and it is, you have to take the risk of the stem cell therapy, because it's a full-blown chemotherapy which you will be going through, and chemotherapy will bring down your immunity to 0. So you will have a very high chance of getting opportunistic infections during the first 100 days. So you have to be very careful when you're choosing this kind of treatment for multiple sclerosis. So you need to fail at least 2 drugs. You're a very aggressive multiple sclerosis, yes, then stem cell therapy can be thought about.
Mona, why do you think some people are interested in this topic?
I think for us as MS patients, we're out of desperation. We always seek for new solutions, for new treatments. And what Dr. Mona mentioned, it was very interesting. So if I can ask her a question like, is there types of stem cells therapy, and how many types are there?
Oh yes, sure. Because you'll see a lot of centers grooming around all over the world saying we are doing stem cell therapy, but not all stem cell therapy is actually stem cell therapy. Okay. The types of stem cell therapy and what we are actually researching is hematopoietic stem cell transplantation. That means you take out your blood, you purify it and put it back after you've done the chemotherapy. That is autologous hematopoietic stem cell transplantation. The other types of stem cell transplantations or therapies are mesenchymal stem cell therapy, very promising, but it is still in the very early stages, and that is more for repair, which we are actually looking forward. Anybody wants to have a repair, get better. Okay, so but these are still in the very early stages. Then you have the embryonic stem cell therapy, also very early stages. We are still in phase 1 and phase 2, and then we have the neurogenic stem cell therapy, which can make new nerve cells, which is what we want. And then we have something called induced pluripotent cells. So you take out the fat cells, reverse it into a stem cell, and then use it. So these are all very, very exciting new stem cell therapies which are coming, but very, very early in the stage. But I think the future is bright, and we are still learning and refining our methods of stem cell therapy. Still in the experimental phase, but I'm sure we will be having it soon as a therapy for MS, as a guidelines. For what patients, which patients, we will have very thorough guidelines for that, and the centers doing this will have special protocols which are standardized protocols, but at this moment not every center has a standardized protocols, because remember, these therapies can cause mortality because you suppress the immunity to 0, okay, and the mortality has been there, which was about 10% before. Now it is about less than 2%. So we've refined our methods, but there is still a small chance. So till we are very sure of what we are dealing with, how to do it, how's the standard protocol, it is still a therapy of research at this moment.
Well, that's an important message. But would you have any other message to share to people who are considering stem cell therapy?
I think it's a very promising therapy. Okay, it is still undergoing a fine-tuning, and we still are awaiting the phase 3 data. Once the phase 3 data is there and we have the risk and benefit, very clearly laid out, then only I think we should go full on for stem cell therapy. At this moment, it is still experimental, but it is still an option on compassionate grounds. If you are not responding to high efficacy medications and you're early on in the disease, then it is still an option under research circumstances.
Very interesting. Thank you so much. And Mona, would you like to add anything, any message for people who are considering stem cell therapy?
I would thank Dr. Mona for this interesting information, actually. And since I'm a patient with MS for a long time, and the type that she mentioned, the relapsing remitted MS, I would tell them to go back to their doctors and neurologists just to avoid the disappointment or symptoms coming back, because everything with MS patients affect their way of life and their way of thinking. So I would definitely send a message to all of them to go back to their neurologist and get all their facts straight.
Interesting. Thank you so much. Two amazing women sharing their expertise on the subject. That was MS Talks 2.0. Let's discuss facts.